Well, good afternoon, everyone. As you know, we've been discussing the Graham-Cassidy health care bill for some weeks now, and I've asked Senator Graham and Senator Cassidy to come forward now and give you their sense of where we are on that issue. And with that, I'll turn to Senator Graham.
Well, thank you, Senator McConnell. Where we're at, we're on path to pass Graham-Cassidy, Heller-Johnson. It's not if, it's only a matter of when. I've talked to my colleagues. Everybody's very enthusiastic about the idea of taking money and power out of Washington, returning it to their states to give their constituents more say about their health care. There's universal agreement in our conference that Obamacare is failing, can't be repaired, is structurally flawed. Our Democratic friends are talking about bipartisanship. Let's engage each other and see if we can find a bipartisan pathway forward that basically changes Obamacare, doesn't prop it up. In terms of Alaska, I've learned a lot about Alaska health care. I'll talk to you privately over a drink. Our friends in Alaska, there are 750,000 people in the state of Alaska, twice the size of Texas. We've learned about their unique needs. I found out things about other states I never dreamed of, and here's what I've concluded. With a process that gives more attention and time, we will repeal and replace Obamacare with a block grant called Graham-Cassidy, Heller-Johnson. The missing ingredient for us as Republicans has been, we know what we don't like. Obamacare is not working. We make that case effectively. But we've had a hard time articulating what we're for until now. Now we have something to talk about that makes sense to 50 Republican senators, a lot of governors, and I hope the American people. If you're a single-payer believer, God bless you, I just respectfully disagree. But what we're proposing is the end of single-payer health care in Washington. This is an idea that worked with welfare reform. In 1996, the Congress, in a bipartisan fashion, under Bill Clinton, took the welfare system and block granted it back to the states with guidelines and guardrails and achieved a lot of success in welfare reform. I am convinced that innovation and flexibility is the key to sustainable, affordable, high-quality health care, and that Obamacare is the exact opposite of innovation, flexibility, and high quality. We're down to one provider in my state. In 2014, we had 5, a 31% increase in South Carolina alone. This system is failing, but the good news for America is Republicans are not just going to deliver on a campaign promise. We're actually going to improve your health care by giving you access to people who care more about you at home than any bureaucrat here could in Washington. It's a simple proposition. Taking basically the same amount of money in a fair way, allocate it to the states. You have to spend it on health care, not football stadiums, not roads or bridges. You have flexibility, but there are guardrails. And I believe this with all my heart, that a governor, a state house member is going to listen closer to you and care more about your family when it comes to your health care than some bureaucrat here in Washington who will never know your name. To the leader, thank you. It's complicated. It's difficult politics. Instead of quitting, you allowed us to move forward. And oh my God, how far we've come in such a short period of time. To President Trump, thank you for engaging. To Vice President Pence, you have moved mountains. Governor Pence has shown us that with flexibility, governors with the right attitude can improve quality. It's called Healthy Indiana. So the leadership team has done everything we've asked them. We're coming back to this after taxes. We're going to have time to explain our concept. We'll have a better process, and we're going to take this show on the road. Dr. Cassidy has a heart unlike anybody I've met for reform and an understanding about people when it comes to health care that I can never hope to match. For decades, he worked in a hospital, nonprofit, serving underprivileged people, and he's convinced me that when the patient is the focus of the exercise, the outcomes are better. Dean Heller is in a tough political race. He embraced the idea, give Nevada the money, we can do better if you let us. Ron Johnson has been a guy, Mr. Smith goes to Washington. All I can say about this little team, including Rick Santorum, who sort of started this process, I've been up here 20 years. I've never enjoyed anything more. I believe this is the most important thing I can ever do for the country, working with my colleagues, is not to just repeal Obamacare, but to replace it with a system closer to where you live, controlled by people you can vote for. And we're going to get there. To my Republican colleagues, we're going to fulfill our promise to repeal and replace. To the American people, we're going to improve health care for you, because at the end of the day, that's the only promise that matters.
Well, to be clear, through events that are under our control and not under our control, we don't have the votes. Okay? That's in speaking to the leadership, speaking to the president. I think Lindsay and he are on speed dial. We've made the decision, since we don't have the votes, we will postpone that vote. Okay? And am I disappointed? Absolutely. It is a disappointment for myself. Just today, there is an eHealth.com report that the average family of three making $82,000 a year, 401% of federal poverty level, will be paying $29,000 per year for their policy, which means officially, according to the ACA, they cannot afford. That isn't just a few families. It is the average family of three making $82,000 a year. And when folks spoke that we didn't define affordability, well, the ACA has a definition for affordability, and no one can afford it. I'm also disappointed for state legislators, where we heard yesterday that Pennsylvania has a gap in their state legislature. News reports that Michigan will. Louisiana does. I can go down the list. We were going to give them relief. We will not be able to, and that's too bad for state legislatures. And lastly, it's for those working families in non-expansion states like Texas, Utah, Maine, Virginia, Missouri, Georgia, Florida, South Carolina, Utah, I could go down the list, who right now don't have access to the dollars that would give them coverage. We're going to give them access to the health care screens, the health care treatment that they otherwise will not have. I'm also disappointed for them. So those who will celebrate the fact that we won't have that vote just yet, think of those families of three making 401% of federal poverty level, those states, and those patients in those non-expansion states. As you celebrate, they are not celebrating, they are mourning. But we'll keep working at it. Our Democratic friends said if we just give them a chance, they'll now be bipartisan. They'll now have that chance to be bipartisan. Thank you very much.
Let me just say briefly, where we go from here is tax reform. Senator Corker and Senator Toomey have reached an agreement on the parameters of the budget resolution. The Budget Committee will be marking up next week, and we plan to move forward on our next priority, which is reforming the American tax code in a significant way for the first time in 30 years. Senator Cornyn.
Well, at our meeting today, Senator Rubio, just back from Puerto Rico, reported to us on the devastation in that, on that island, and reminds us of our responsibilities to step up and help our fellow American. Senator Schumer this morning said it was imperative that we provide additional hurricane relief for the victims of Hurricane Maria. Yet yesterday in the House, Nancy Pelosi blocked hurricane relief that would benefit not only the victims of Hurricane Maria, but also Irma and Harvey as well. I would hope that she would reconsider and listen to Senator Schumer. It appears that Ms. Pelosi's compassion that she expressed in the days following Hurricane Harvey was short-lived, and now she's attempting to block this relief for victims in my state, in Florida and Puerto Rico, in order to attach it to some other unrelated legislation. So I hope that Senator Schumer will reach out to Ms. Pelosi and get her to agree to lift her hold on this important relief, and that we don't forget any of the victims of the terrible natural disasters that have occurred just recently, whether it's Harvey, Irma, or Maria, or any others that may exist, including, as our friends from the West remind us, the wildfires out west.
Yep.
Mr. Leader, you pulled your top priority again. You have a tough election in Alabama where your candidate might lose. Would you say this is a tough day?
Look, we haven't, as Senator Graham and Senator Cassidy pointed out, we haven't given up on changing the American health care system. We are not going to be able to do that this week, but it still lies ahead of us, and we haven't given up on that. we do think it's time to turn to our twin priority, reforming the tax code. We've reached significant agreements inside the Budget Committee to go forward, and I'm optimistic that we'll achieve that.
This question is for Senator Graham and Senator Cassidy.
Yeah.
You said, the first thing you said is we're on a path to pass this bill. We're not doing the bill this week. Isn't that a little bit disingenuous, considering the fact that we've been to the precipice with health care so many times over the past couple of years, right up to doing it this week, and the bill is pulled again?
Well, it took 18 months to pass Obamacare. It's going to take a while to repeal it, but here's what I want you to know. There are 50 votes for the substance. They're not 50 votes for the process. At the end of the day, read Lisa Murkowski's statement. She probably is the best indication of where a lot of people are. We spent a lot of time trying to make Alaska health care better, not just replace Obamacare. So what am I confident of? With a new process, with more hearings, with regular order, that we're going to get 50 votes. The reason I say that is because I believe it, and it's not about our idea of being lacking. It's about the process, about the short period of time we have, and the leader could do nothing about that. These are the rules of the Senate. So to anybody out there who thinks that Mitch McConnell has not done all he could, you don't know what you're talking about. To me, anybody out there who thinks President Trump is not engaged, you don't understand. He's fully engaged with a lot of topics, including health care. So I just want you to understand what Bill said is true. We don't have the votes this Saturday. It's not because of the substance of the idea. It's because of the process, the hand we were dealt. And do not be celebrating losing an opportunity to repeal and replace Obamacare because it's collapsing. To my Republican friends throughout the country, there's plenty of fight left in us, like there's fight left in you. And finally, to my Republican friends, we've got an idea that defines us differently than our Democratic friends, because the choice they're going to give you when Obamacare fails is Medicare for all, which will be Medicare for nobody. Can you imagine being 62 like I am, worked all your life, you're getting ready to go into Medicare, and Bernie invites 200 million of your closest friends to join you? So this is going to collapse. They're going to try to have more government. We're going to take a collapsing Obamacare system, take the same amount of money and put it in the hands of people that are closer to you. And I am confident as I can be that Graham, Heller, Cassidy, Johnson will be the alternative to Obamacare. It will be in this Congress under a better process.
Let me just mention something. There's a Pentecostal bishop back home who once told me that you cannot stop an idea whose time has come. It's actually bipartisan that Obamacare is not doing well. Bernie Sanders has 15 co-sponsors to do their single-payer plan. But unlike ours, which focuses on the individual market, which is about 4% of the population, and the Medicaid population, which is busting state budgets, he wants to do the whole enchilada. He wants to take away employee-sponsored insurance from folks. He wants to take away TRICARE. He wants to take, you name it, he wants to take that away from folks and tax them more. So the idea has come. Obamacare is not working. It's just a question of whether we give power back to patients and states or whether we consolidate it at the federal government. I do think that, as you see, a family of three cannot afford the lowest price plan when they make 401% of federal poverty level, that the idea unfortunately has come, and it will be accomplished, not because of us, but because that family of three cannot afford their policy.
Okay, thanks a lot.